Hey guys, Dr. Stephanie here. And if you've ever had a pain deep in your butt, you may have had piriformis syndrome. So the piriformis is a small flat muscle that goes from basically up here, kind of across your butt down to the femur down here. And the sciatic nerve runs right next to that muscle. So it's common that if the sciatic nerve is irritated, that can cause the piriformis to tighten up. And also, if the piriformis gets irritated, that can cause irritation on the sciatic nerve. So that can also mimic sciatica. So you can get that kind of shooting pain down the back of your leg, maybe some numbness and tingling. But the goal to treatment for piriformis syndrome is really to figure out what's causing it. But most of the time, we need to work on some hip mobility, maybe kind of mobilizing that muscle, getting it moving if it's a little tight, but also working on hip strengthening. You want to work on strengthening the glutes, all of the muscles around that piriformis, because if those muscles are weak, excess stress gets put on that piriformis muscle. And so then that gets tight, and then that can cause the sciatica and also just pain deep in your butt. And sometimes that pain is worse when you're moving around, but sometimes it's worse just sitting. It's hard to sit for a long period of time. So I'm going to show you 6 exercises you can start doing to help kind of loosen up that muscle and also build strength around that muscle. So we're going to start on the floor here on our hands and knees, and we're going to start with a little hip mobility exercise. So from this position, you're going to kick one leg back, and now if you're having the piriformis syndrome, usually it's just on one side. It can be on both though. So if we have it on this left side here, we're going to be doing this exercise with this left leg. So you're going to straighten one leg out, and then you're going to just move this leg out to the side and then move it back in. So we're just kind of working on moving our hip. So we're working on some mobility, also some hip extension and abduction strength. So it's a little glute strength as well, but we're just getting our hip moving too. So you want to go back and forth 10 to 15 times. If you want to do this on both sides, you can, even if you're only experiencing the pain on one side, because it is helpful to increase your mobility and strength on both sides. That can prevent the pain in the future, but it can also just help you feel better overall. Okay, so 10 or 15 times just like this, and just bringing that leg out as far as you can comfortably. And then from this position, we're going to bring this leg up here, and from here, we're just going to do a little, this kind of stretches that piriformis muscle there. So we're going to be in this kind of deep lunge stretch, and we want to rotate this knee out to the side. So we're just going out. So we'll put our hands on the inside of the foot. Just rotate that knee out, pause for a couple of seconds, and then rotate it back in. Rotate out and back in. So just kind of nice and slow, go out as far as you can comfortably and come back in. And you should feel a good stretch kind of deep in here. And you want to do about 10 of these. Just stretching there and coming back in. And then from there, we're going to turn on our back and go to a little more strength-focused exercises. So we're going to cross one leg over here, and when we cross our leg like this, that actually allows a kind of a deeper stretch on that piriformis. So this is another way you can stretch. We're not going to do a stretch here, but you can pull this leg back and you'll feel a stretch in your piriformis. But from here, we're going to cross here and lift up into a bridge. So this bridge is working on glute strength and core strength, but it's just a little bit more piriformis focused. And to get a little stretch in that piriformis, you can also kind of let your knee, like push down with your knee a little bit when you lift. So lift up and then push that knee down towards the ground and back down. Do about 15 to 20 of these. Just lifting up, pushing that knee down. And again, you can do them on both sides if you want to. Then we're working on both sides. So even if you're not having pain on both sides, we want both sides to be strong and mobile. So it is a good idea to work on both sides. So again, 15 to 20. And then from there, we're going to go back here and we're going to come up in a bridge position and do a bridge march, just like this. This one I like to do for about 30 seconds and repeat that 2 or 3 times. So just come up into that bridge, try to maintain this position, and we're just going to march like this. And if you feel like your hips are sinking down, it's probably time to take a break. So just kind of reset, and then when you're ready, you can lift and march again. So this is working on glute strength, but also working on hip flexor strength and core strength as well. Okay, so now we're going to grab a ball, just any small ball like this. If you don't have a ball, you can use a pillow or a rolled up towel, just something that you can put between your knees here. We're going to be on our side, on our elbow like this, knees bent, ball between our knees, come up into a side plank, and then you're going to rotate your leg up like this. So this is working on hip internal rotation. The Piriformis is a hip external rotator. And so we want to work on external rotation, but we also want to work on internal rotation. So those other muscles that work on internal rotation, if those aren't strong, that can put excess stress on the Piriformis. So we want to make sure that we strengthen those as well. So do 2 to 3 sets of 10 here. You can also do that on both sides. And then we're going to go ahead and stand up, because it's important that you do all of these exercises, but it's also important that you progress the exercises. So if the exercises we started doing get easy, then you don't want to keep doing exercises that are easy for you. You want to make sure that you make them a little bit more tough. And so for this next one, we're going to do a kickstand RDL. So 1 foot in front, and this one, we're going to work on both legs. So this one, it's important to just do on both sides. And maybe here, I'll show you here. So we're going to put 1 leg in front, 1 leg in back with your toes on the ground, just kind of supporting you. Hold this weight in both hands. And an RDL typically is just keep your back up straight. You're going to hip hinge forward, but we're going to add a twist. We're going to hip hinge and kind of rotate to the side here. So hip hinge, rotate to the side. Really working those glute muscles here, some hamstring as well. And you want to do about 2 to 3 sets of 8 to 10. And use a weight that's challenging for you, so you don't want it to be too easy. And then you'll go ahead and do the same thing on the other side. So back leg just supporting, hinge and rotate to the inside. Again, 2 to 3 sets of 8 to 10. So if you're having any piriformis syndrome, any pain kind of deep in your butt, even if you don't know if it's the piriformis, if it's kind of in that area, or you're experiencing sciatica, all of these exercises can help. So start doing these to work on your mobility and your strength, and hopefully get rid of that pain that you're feeling.